Good
Thank
afternoon,
you.
everyone. Welcome to Doc Talks. I'm Dr. Manju George, the Scientific Director of Paltown. Today, we have with us Kristin Alfaro, who's the Program Director for Clinical and Translational Research at MD Anderson. Kristin, thank you so much for your time and for your interest in educating patients. Please tell us about you and talk to us about the trials at MD Anderson.
Thank you. I really appreciate it, Dr. George. I want to thank everybody, of course, for the opportunity and for taking time out of their day to kind of sign on and have this chat. I think it's a great opportunity for us to kind of approach clinical trial enrollment and therapies at MD Anderson from both ends of the spectrum and improve it all the way along. As Dr. George indicated, I am the program director for GI Medical Oncology at MD Anderson. I am a proud MD Anderson employee for 15 years now. My job functions really focus around encouraging and translating some of the basic science research efforts into clinical trials, kind of expanding our clinical trial portfolio and making sure that we are doing our best to provide the broadest and most comprehensive level of access for patients. There's a bit of a review of what I hope to accomplish during this brief discussion today. We're going to review kind of how a second opinion will work at MD Anderson, how you'd go about finding a clinical trial, some of the clinical trial participation overview and steps that you might encounter while participating in it, a review of our clinical trial offerings and some tips and take-home points, and then we'll stop for some questions along the way. So second opinion at MD Anderson, this is a frequently requested type of function. MD Anderson is one of the most comprehensive GI and colorectal programs within the country. We have an extremely high patient volume. MD Anderson, of course, is a comprehensive care center, and they stand apart and in my opinion, at least, superior to some of the regional care offerings. We believe and pride ourselves in being able to offer some of our most experienced providers. They are professional and passionate caregivers, and our goal is to detect, of course, the colon, rectal, and anal cancers at the earliest possible stage when treatments are most effective. We do use precise technology to diagnose and stage our cancers, such as virtual colonoscopies, a non-invasive screening method that was pioneered by MD Anderson physicians. Our surgical colorectal center also uses minimally invasive robotic and laparoscopic surgery techniques for faster recovery for patients. Most of our anal and cases will need a permanent colostomy thanks to our sphincter-sparing surgery. And treatment options include a variety, including proton therapy, targeted chemotherapies, and several types of radiation. These are used alone or in combination to develop personalized treatment plans for each of our patients. Along with our world-class treatment options, our colorectal center also provides genetic testing and counseling for people with family history. We have subtypes of patient cohorts that we prioritize for access. In a perfect world, we'd be able to see everyone that came knocking on our door. But in reality, most standard care options you can comfortably receive from proximity closer to your home. And you would come to see us if you fit into one of the categories listed below. If you're MSH or MSI high or D mismatch repair deficient or POL mutated, if you have a BRAF mutation, including the V600E or other atypical BRAF mutations, if you are HER2 amplified or KRAS G12C mutated, if you are part of the young-onset group or early stage, meaning untreated cancer patients, or surgically eligible staff patients. The other caveat is that we have an open door policy for all Texas, Louisiana, and Oklahoma residents, which is just because of the treatment center. How you could prepare for your first visit. We do use MyChart, which is a patient interaction portal between our providers and staff and you and your caregivers. You can upload your documents in MyChart. This would include, of course, your insurance card as well as a valid photo ID. There are pre-appointment forms. You can check or call to ensure that you have proper insurance coverage. And there's a hyperlink here for accepted health insurance plans. It's beneficial to organize your medical records. This makes it a lot easier and more seamless for our providers to review your status. There is a checklist provided hyperlinked on this document also for the important documents for you to bring to this. Now that we live in the era of COVID-19, we also have entry, screening, and patient visitation guidances that are constantly changing as the COVID-19 spread increases or decreases. So you're going to want to make sure that you're up to date on all of our screening and visitation requirements. We can also assist you with domestic and international travel. There are phone numbers or an email to kind of help you plan where you're going to stay, how you're going to get here. There's updated parking information for our very large campus. You're going to want to make sure that you are parking within a reasonable travel area to where your appointments are. I will highlight that patients and families should plan on staying in Houston for at least 1 to 5 business days. We are not trying to hold you here, but just as things constantly are shifting within our clinic, we're pretty high volume and fast paced clinic. And if you're coming for a second opinion, we might actually be able to offer something that you would need to tack on a few extra visit days for. So please keep that in mind and keep your travel plans flexible. In addition, there's a list at the bottom of the screen of some other items to consider bringing with you. And this would just make things, again, onboarding faster, make you a bit more comfortable and a little bit more prepared for your initial visit. What you can expect from your first visit at MD Anderson, you can do your patient registration appointment in either by phone or in person. You should try and set up your access to your MyChart. You'll make sure, again, to have your insurance and photo ID available in there. And then our patient access staff members will help review with you and complete the forms and the information that is requested within your MyChart record. When you have your initial visit with your doctor and care team, they will review your medical history and perform a physical exam. We often get questions as to why this second opinion or initial screening exams cannot be done completely virtual. Physical exams are one of the things that really need to be done in person. They're definitely more comprehensive in person. We can also, when you're in person, schedule further testing and therefore couple it with that initial visit, which then would reduce a subsequent visit need. And they can discuss with you at length, of course, any of the next steps or possible options for you and your family. There is a first visit guide that I'm hyperlinking here to kind of review the information that I'm giving to you today. It's got 36 pages of information and resources and guidance for you. It'll go over the roles of your care team, right down to what color uniform they wear, how to manage your care online using your MyChart patient portal. Of course, your rights and responsibilities, what you can expect from us in terms of partnering in your care and tips for getting around. There's also a few pages that will review our financial clearance process and why that's an important step in patient registration. And then it'll provide an introduction to some treatment decision clinical trials for you, as well as I mentioned before, kind of resources for caregivers and patients. And then areas for contacts and note-taking. We also have a new patient and family orientation programs. You can see those that are advertised on our webpage. I would definitely encourage you guys to check those out if you're interested in coming to MD Anderson. I find them to be good information and very helpful to give you at least a basic understanding. With that, we're going to kind of transition into how do you go about finding a clinical trial at MD Anderson. I did want to provide just a brief slide, an introduction for anybody that might need it, of what exactly is clinical research. We at MD Anderson define this as a systemic investigation, including research, development, testing, and evaluation that is designed to develop or contribute to generalizable knowledge. As you may be aware, because I know you guys are all very well educated patients, there are 4 phases of research. We dub them phase 1, 2, 3, and 4, with phase 1 being a smaller phase trial, meaning we only enroll typically anywhere from 15 to 13 people. This may not necessarily be disease specific. The main concerns of this type of phase trial is to address safety and dosing. You'll hear the terms pharmacodynamics and pharmacokinetics tossed around quite a bit. This is, of course, to ascertain how our agents are being consumed and used within your body, and to determine our maximum tolerated dose. We would like to make sure that we are giving you the dose of the agent that is most effective without causing any unnecessary toxicity or complications. In phase 2 trials, you'll typically see that they are less than 100 persons. These tend to be more disease specific, and they will be focused more around effectiveness and safety in a specific disease or condition. Phase 3, we get to compare efficacy to the standard of care options. This one typically would be 100 or more people. You'll see 2 different treatment arms, experimental care versus a standard of care, and we'll be measuring the effectiveness in a large group of people. Phase 4 are really for long-term safety. Typically, these will be over 1,000 people. It'll be post the market approval of the agent or combination or device. And we are trying to assess long-term safety and effectiveness. Some types of clinical studies that we have to offer at MD Anderson, I did want to highlight, are not just around experimental drugs, combinations, or devices. We also offer quality of life trials, which are going to evaluate methods to improve the comfort and quality of life for individuals with an illness. We have diagnostic and screening trials, which are aimed at finding methods to diagnose or detect certain diseases or conditions, either in a more advanced or earlier stages, or sometimes just an easier methodology. We have prevention studies that are focused on disease prevention in people who have never had disease, or to prevent the disease from recurring. You guys are probably most familiar with investigational therapy studies. These are experimental drugs, combinations of drugs, radiation therapy, or surgery to treat the conditions. And then kind of in parallel, we have device studies, which of course evaluate the safety and effectiveness of medical devices. Some introduction to your clinical research team. At MD Anderson, we frequently use the title research nurse, clinical study coordinator, research data coordinator, investigational pharmacist, and principal investigators. Your research nurse, study, and data coordinators are staff that are delegated by the PI to perform tasks that have been designated to the conduct of the trial. These tasks will include coordination and evaluation of patient participation in the day-to-day management of the study, as well as data collection and entry requirements. Our investigational pharmacists are responsible for administrative management of all of the investigational drugs at MD Anderson. They will focus on the drug acquisition, inventory control, and accountability. And of course, the principal investigator, sometimes also perceived as the physician from our patients. This is the lead person responsible for the conduct of the trial at the site. They must be qualified by education, training, and experience to conduct the trial. They, of course, delegate staff and tasks as needed, and they are responsible for the supervision of those staff and hold the ultimate responsibility for the conduct of the trial at their site. The next slide reviews clinical research at MD Anderson by numbers. So our recent observation, we had over 174,000 people who sought care at MD Anderson, of which 47,500 were considered new patients. We have enrolled 9,684 of those patients screen them, into some clinical trials. And then there's 1,600 clinical trials that were available throughout the institution. In addition to these, also have 1.5 million annual outpatient visits. So again, underscoring that patient volume that we have. And then underneath, you'll see that we have approximately only 241 research nurses and 443 clinical studies coordinators. So you can imagine exactly how busy they are and how devoted they are to their duties. Part of these duties and trial activities may go on without you even knowing. Our pre-screening activities largely occur in the background of clinical visits. A lot of our research nurses and clinical study coordinators will review the daily patient schedules. Again, comparing your medical records to the inclusion criteria of any of the number of trials that are being offered. And then once they determine that you're a good fit, likely that would be the time where they would approach your treating physician, or your treating physician can loop them in and discuss clinical trial opportunities. If you're interested in a clinical trial, you of course are also welcome to bring up or ask any of our providing staff if there are any applicable trials for you. After we have completed the pre-screening steps, comes the actual consenting to a clinical trial. This is where we have the informed consent document that will explain the activities and objectives of the trial. You'll have a lengthy discussion with the physician, your caring physician, and the providing team, exactly what the procedures and assessments are involved, the frequency of visits, the benefits versus the risks, etc. They can also then kind of give you an estimate of the cadence of these procedures and assessments, meaning like how frequently you would come in or how long some of your visits might be. During your participation while you're on trial in therapy for any of our clinical trials, most visits will, of course, include labs, imaging assessments, or things such as EKGs. And then we are always, of course, looking to try and keep our participants in compliance with the planned protocol activities of the clinical trial. This helps us in terms of analyzing the data once the trial is closed. Follow-up visits can be done in person or via phone. Again, this depends on really the flexibility that some of our sponsors have provided, as well as some of the assessments and activities that are unique to each of those visits. It's important, I think, to underscore that each protocol or each clinical trial has specific and unique trial activities. They are not all the same. So these are just very generalized statements about what to expect for clinical trial participation. Some therapies that have been developed at MD Anderson, I did want to bring to your attention this graph or this chart that'll tell you these are the drugs on the left-hand side that have actually come out of approval for various indications through clinical trials that were developed at MD Anderson. So again, underscoring our experience and our contributions to not only, of course, GI, but other and all oncolytic areas. Currently enrolling trials at GI. I was indicating to Dr. George earlier, our trial landscape actually is much too large for me to detail in either 1 hour discussion or on this slide. We do generally pride ourselves on trying to have an available trial for every patient. So on the left side, I've provided kind of like a bucketed review of types of trials that we would categorize patients in. The mapping that you see in the background is what our staff and providers use to navigate through all of our clinical trial offerings. Each of those are hyperlinked to not only like the protocol details and study activity highlights, but also in-depth inclusion and exclusion criteria. We have dedicated communication channels for our team that constantly, again, are reviewing those patient charts for eligible patients, the ongoing amount of spots that any given trial may have, or any staffing concerns that may be needing to be addressed so that we can open up additional spots to a trial. Certain study activities will be required to be in person. And again, just a reminder that no study activities can occur prior to our consent of our patients. There's a MD Anderson clinical trials booklet that we will make available to our patients that are considering clinical trial participation at MD Anderson. And I am going to hyperlink this at the end of the slide deck so that you guys can feel free to reference it and use it. I personally think that it's very useful in making decision of therapy options, regardless of where you go. MD Anderson happened to, of course, publish this trial booklet, and it's available via our website. But I do think that there are really great questions to ask yourself, to ask your care team and providers while you're making your decision. Things to look for in the informed consent documents, or discuss about the details of the visits or what might be required for you. And additionally, particularly specific to MD Anderson, there's also a lot of support references for caregivers as they have someone participating in a clinical trial. Specific to colorectal cancer, you guys are all, I'm sure, very aware that it's the second leading cause of cancer-related deaths in the United States. There's an alarming rise of early onset colorectal cancer for diagnoses under the age of 40. And for patients with stage 3 colon cancer, approximately 50% can be cured with surgery alone. The addition of chemotherapy may cure 10 to 20% more patients, and immunotherapy, which has recently been touted for colorectal cancer, has thus far been proven somewhat unsuccessful, although we're hoping to improve on that for outcomes with our patients with colorectal cancer. So this really underscores the need for new effective therapies. Such questions are, can we use immunotherapy to cure more patients in combination or in different methodologies or modalities, more patients with colorectal cancer? As I mentioned at the beginning, I participate in trying to develop and strengthen our clinical trial portfolio. Some unique clinical trial opportunities that are being developed, and some that are already available at MD Anderson specifically for colorectal patients. We're using immunotherapy with dual immune checkpoint inhibiting agents targeting the MSS stable cohorts of colorectal cancer patients. And we're also have developed a lot of personalized therapies or therapies. These are considered really cutting edge treatment options that are typically only available at comprehensive cancer care facilities. Another highlight for our program is the use of circulating tumor DNA detection. We are using this to identify the presence or absence of microscopic residual disease after surgery. We are then using these results, meaning they are present or absent, positive or negative, to stratify our patients for clinical trial participation, for treatment, and for these kind of follow-up surveillance activities. ctDNA negative or absence would imply a lower risk for recurrence, whereas positive or presence would imply a high risk for recurrence of disease. We've developed an entire service program related to this. We call this the INTERCEPT program. The aim of the INTERCEPT program is to intervene with novel technologies for our high-risk patients. The INTERCEPT program specifically reviews every newly diagnosed colorectal patient, as well as any of the previously treated but surgically eligible metastatic patients. Again, they are going to be reviewed by multidisciplinary team management. And then we will use this liquid biopsy to then follow them and surveil them, and then make adjustments to customize their therapies. And we do this in hopes, of course, to convey better health outcomes for our patients. Another program that I wish to highlight is our Young-Onset Colorectal Cancer program. We recently launched this to coincide with the first day of Colorectal Cancer Awareness Month, so at the beginning of March. Their vision, of course, is to be a worldwide leader dedicated to ending the burden of young-onset colorectal cancer. And they offer, in addition to just the traditional multidisciplinary therapy team, also supportive services, whether it's addressing fertility, nutrition, financial, or certain amenities that make the life of our patients a bit more easy. There is a business lounge for them to continue working, technologically platform that's available for them for communication. They do family genetic medicine testing along with the coordinated multidisciplinary care. And they are developing their own clinical trial pipeline to complement the rest of our service line. And this is a review to some of that integrated services that we provide for them. In summary, I wanted to underscore that clinical trial participation is not just for the end of disease therapy options, and that there are different options of trials that are offered. We have, as I mentioned, the advanced multidisciplinary teams and programs such as our minimal residual disease, INTERCEPT, and young-onset colorectal cancer programs that are staffed with passionate providers and administrators. And then a personal summary note is I would encourage you to seek molecular testing whenever possible. I do believe that molecular testing is a good door to open additional therapeutic options as well as access options. And that's both within and outside of MD Anderson. As I mentioned before, there were links throughout the presentation for you guys to kind of reference. I didn't pretend that you would be able to retain everything from a 30-minute discussion. So there are links for you to kind of reference and investigate at your own pace. Some additional resources that I'm highlighting on this slide are the GI Med-Onc department website, as well as our colorectal center website. You'll find lots of information about the physicians that participate, a lot of our access service lines and things of that nature. There's also a colorectal minimal residual disease website. This is not an MD Anderson website, so there are additional resources that are of interest and highlighted on this website. Your first visit guide that I did review earlier and the MD Anderson clinical trials booklet, I think are also really good references for anybody that's looking for treatment options at MD Anderson. And with that, I will default to you guys to just let me know if you guys have any questions.
Hi, Kristin. This was very informative. Thank you for all the information. So maybe I can start by asking, so you mentioned those 2 states besides Texas where, you know, people are covered, right, when they come for a second opinion visit. Mm-hmm. What about people from other states? What are the things that they have to keep in mind?
Sure. So if we go back to the second opinion slide, we are really outside of Texas, Louisiana, and Oklahoma residences. These other bullet points, the MSI high and POL mutated or mismatch repair deficient patients, BRAF mutated, HER AMP2 amplified, the G12C KRAS mutated, are young onset at early stage, and any of our untreated or early stage or surgically eligible metastatic patients are our prioritized access algorithms for patient registration.
Okay, so which means that if patients are in any of those categories, then what would be the step? They'd call up or email MD Anderson and then talk to someone, and then they would arrange for the second opinion visit. Is that how?
Correct. So you can do that patient registration, as I mentioned, by phone or in person. There's also an email that's available on our webpage. And then our patient access registrants will help facilitate you filling out all of your forms, you know, verifying your insurance coverage and transfer of any of your medical records that you might need. Okay.
Okay, and the other question would be that because you're prioritizing patients who haven't received any previous therapy, right? Mm-hmm. So I was wondering that whether, you know, because would you recommend that there might be a shorter time period for getting appointments if you're a new patient versus someone who has already started chemo at their local clinic? Do you think there's a difference?
Likely. I can't promise that there is a difference one way or the other, but because of the prioritization schema that we've like rolled out to really kind of, again, address the patients that we feel like we can help the most, a lot of them end up following on either end of that spectrum. So either like that early stage, untreated, newly diagnosed patient, or I've been through everything, failed through everything, and I'm at the end looking for an advanced option that I can't find anywhere else.
Okay. And then the other question that I had is like about, I heard that like when patients were consulting from other places, they're asking for like some kind of a security deficit. Could you comment about that?
I'm not part of our financial clearance center, so I don't know their daily operating procedures. As I indicated on the slide deck, there's a link here of our accepted health insurance plans. As well, when you contact the patient registration or the patient access providers, they can help navigate some of those financial clearances for you. In that first patient visit guide that's linked here, there is a couple of pages just kind of reviewing information that you might need for the financial clearance, how to kind of navigate your enrollment or your clearance that way, and why it's important, of course, to wait until after you've received your financial clearance.
Okay, that makes sense. And then as far as clinical trials are concerned, do people have to register as a new patient first before they start enrolling in the trials? Or what, I mean, the reason I ask is, like, if people are interested in pursuing trials at MD Anderson, would you recommend that while they're going through treatment, they start the procedure so that, you know, when they start progressing on standard of care, then they can, you know, reach out and enroll? Or do you think that it's best to wait?
So we would not be able to enroll patients from other hospitals at MD Anderson. Like, you would be a patient, you know, an MD Anderson patient would be the only ones that are eligible for MD Anderson clinical trials. And that's really just so that we can, again, ensure the quality of care. As I mentioned in the clinical research review, our PIs are ultimately responsible for the success and safety of our clinical trials. So they really need to be intimately involved with that patient care. If you are falling into one of the buckets of our access prioritizations, I would encourage you to call at that time. You know, we, of course, also offer the standard of care therapies and other array of therapies in between standard of care or first line and clinical trials. So you're going to receive the same opportunities at MD Anderson. You don't have to wait, if that's what you're saying. Like, I don't want you to feel like you have to fail standard of care therapy elsewhere before you investigate becoming a patient at MD Anderson.
Okay. So, like, for example, I have seen many patients, what they do is that, you know, they get diagnosed and they start chemo at their local clinic, and then they decide that they're going for a second opinion consult, right? And they come to MD Anderson and they talk to the oncologist there, and they are told that, you know, this for you, with whatever molecular markers you have, what you're getting is the best thing for you now. And then the patient decides that they're going to have the treatment at their local center. But then that also enables them that once they run out of the standard of care, then they can come back because they've already registered with MD Anderson, right?
Correct.
So then it would make sense for patients to have that process done, because then, you know, at the time when they're running out of treatment and they have more side effects or the disease progression, at that time, they don't have to worry about now what do they have to do, right? Because once you are a new patient, you know, registered in your MD Anderson database, then if trials are available, they would automatically get notified, or they could reach out through their doctor to find out if there is anything that they qualify for, right?
Sure. There are lots of resources for you to investigate where clinical trials are available, not even just at MD Anderson. I know it's not a crowd favorite, but clinicaltrials.gov is aiming to be, of course, the comprehensive list for the nation as to, like, where clinical trials are offered. So again, if something's offered at MD Anderson, it could also be offered locally to you, at which point I would even encourage you to participate locally, because it's just going to be more convenient for you. I think that if you're going for a second opinion at MD Anderson and you do receive, of course, it happens even outside of GI, right? Like, if you're coming in for a second opinion and you haven't gone through the first line or standard of care therapy, and you're not falling into one of those unique buckets of, like, a refractory or worst of the worst case scenarios, do the convenient thing of getting yourself the first line therapy and the standard therapies at home. Be with your family for as long as possible, your friends, your support group for as long as possible. Make it easy for you to attend all of those appointments with your, you know, whatever oncologist that you have locally. MD Anderson's not going to go anywhere. So we'll be around and we'll be available. And I do think that one of the greatest things about working at MD Anderson, our physicians are very transparent about that. If you can receive the same quality of care at a local area that is much more easy for you, we're going to let you do that. We want you to have that quality of life and that ease of care. We're not trying to overburden you, and we're certainly not here to make a buck off of you.
Okay, and I'll go through some of the questions. Do you work with other facilities in clinical trials like UT Southwestern in Dallas?
We liaise with them. Some of the clinical trials you'll find would be offered at both sites or multiple sites, right? Some of them, as you probably have already suspected or found out, have been trained at MD Anderson. So you can have an opportunity to receive MD Anderson-like care, but under a different banner, if you will. We also have Houston area locations that are identified MD Anderson care facilities, but are just not local or not located in the center of town. So a little bit easier to get to sometimes. Clinical trials sometimes are more amenable or less amenable to rolling out to those, those suburb locations, but we're doing the best that we can to make sure that we have equitable provisions at each of those locations.
Okay, thank you. So there is another question here. This person's MDA Houston oncologist actually moved to a new institution. So they want to know that when they return to MD Anderson for more care, will they know the doctor that will be assigned to them? And what is there a procedure? I mean, I don't know if this is something that you can answer, but.
I think that if you have certain requests, our patient access registrants aim to do the best that they can. There's always, a certain weight, I guess, for decisions that you have to make also. The physician that you want or you want to request may not have any available openings, and there may be another available spot that can be seen sooner. Or maybe, there's been faculty changes, et cetera. So I would encourage you to keep an open mind, but certainly if you have a preference, let them know. And I know that they'll do the best that they can.
Okay, thank you. And then the next, another question we have is what kind of molecular testing, you said that you're giving a plug. What all do you suggest that people get?
So the INTERCEPT program, which is one that I'm intimately involved with, is doing a circulating tumor or ctDNA testing. This is looking at, of course, the circulating tumor DNA within your blood. And we're following that kind of longitudinally throughout your disease to, again, give us a clue as to when that minimally residual disease might be coming back to light, current concerns for progression, or kind of like a hesitant green light for us to say, okay, maybe we just want to watch and wait you for a little while. We don't have to treat you unnecessarily with adjuvant chemotherapy, et cetera. There are other molecular profiling options. We also have a MD Anderson panel of, I think, almost 500 genes now that just are sequenced based off of your tumor DNA. That can open up options, again, if targeted therapy and personalized medicine and even immunotherapy are really kind of still actively used and being investigated within our clinical trial portfolio. The more information we have about your tumor, I think, is the better.
Okay. And then when a patient is part of the INTERCEPT program, they will get the results of the ctDNA testing as and when it's done, right?
Yes.
It's shared with the patient. Okay.
Yes, it's a clinically validated test, and the INTERCEPT program specifically tries or aims to assess the ctDNA every 3 to 6 months within a patient for up to 2 years. And that has been approved with Medicare since last November. So other insurers typically follow suit and should be something that you should explore even outside of MD Anderson.
Okay. And then are you using an in-house test, or are you using something that is available outside? Is that what you meant?
We currently have both inside and outside tests that are available. The ctDNA test, there is a commercial vendor that we've partnered with. MD Anderson policies preclude me from plugging someone specifically. Yeah, I mean, I think if you do your own investigations, it'll be pretty obvious as to who the commercial leader for that test currently is.
Okay. So the next question is, how do international patients get involved with MD Anderson trials? How would that work?
Sure. They have the same patient registration steps, whether you're domestic or an international patient. We do have the specific travel center for our patients to help all patients, but obviously understanding the international patients face a bit more complicated navigation of traveling to Houston. There is an on-site hotel called the Rotary House at MD Anderson. And also we've partnered with some of the other hospitals and located in immediate surrounding areas to really kind of refer to you and make sure that you have options for places to stay.
Okay. This question is, after having the ctDNA negative, is it possible that the cancer cells could mutate in the body and the test would not be able to identify if there is any cancer in the body? I think it's a very technical question.
Sure. And that probably would be best routed to somebody that's like a technical analyst on that assay development. I don't want to say that anything's not possible or ever possible. The vendor that we've partnered with, though, have a limit of detection that is 0.1%. That's pretty darn good for a commercially available assay. And again, that I can't plug them specifically, but this is a tumor-informed assay. So like they're looking at both the genetics of your tumor as well as your blood, and comparing them and following them. So they're customizing the panel specific to your tumor with an incredible detection rate. So I think it's definitely at least the best that we have to offer. And again, it's a commercial vendor, so do your research, and even outside of MD Anderson, ask questions and seek it.
Okay. So this other question is, this patient's husband has gone through a new patient process at MDA. And then she wants to know if, you guys will let them know when a trial becomes available that he qualifies for, or is that something that they have to do with their local team to find one?
Yeah, I mean, every department does operate a bit differently in terms of their clinical trial structure. Specifically for colorectal cancer, our clinical studies team is constantly surveilling, as I mentioned, that daily schedule of being in our clinic, looking over those that are eligible. That being said, we're all human. Sometimes we're busy. I always tell patients, I think it's a great idea for you to continuously ask and bring up, what are your options? At worst, it will make you a much more informed patient.
Mm-hmm. Okay, that sounds good.
And definitely encourage anybody, write down my email, follow me on Twitter. I try to respond as much as I possibly can. A little personal tidbit, my grandmother was diagnosed and eventually succumbed to colorectal cancer. So I have a personal tie to this too. And once upon a time was a patient advocate myself, trying to research, opportunities for a loved one. So I can definitely sympathize.
Okay, thank you. And then the other thing, like I've got a couple of questions from different people, especially, the crcmrd.com, that website has the diet and lifestyle trial that was highlighted there. Mm-hmm. So the question was like, if a person wants to get enrolled in that specific trial, is there a trial coordinator or someone related to that trial to call, or is it again the same, whatever information you have given that would apply to anybody who's interested in any trials at MD Anderson?
Yeah,
right?
If you want to provide your contact information, I also monitor that website, so I can try and help connect you with the right person. Ultimately, though, you will need to go through the patient registration process and steps. It never hurts to send us an email, a quick, like, this is what I have as far as your patient information. We'll try and do the best that we can, but I cannot promise, clinical trial enrollment without the full assessment, which would include things like those physical exams and those labs that just can't be done remotely.
Okay.
I know.
Okay.
I wish that we could do everything remotely too. And I do wish that we could also accept everyone, but we just don't live in a perfect world.
Yeah, I understand. So I think that the answer or the short answer to your question would be that if anybody is interested in any trials that are going on at MD Anderson, the best thing would be for them to actually look through the links that you have provided. And then if possible, also, email them saying that they're interested in this particular trial and why they are interested in that one, right? Sure. Like if they're ctDNA positive, or if they have a BRAF mutation, or whatever their situation is, right?
Correct. And our colorectal center website has a listing of our trials that are available also. So that's a good place to always reference and track.
Yeah, like people could just bookmark it and keep it and see what is new and all of that. Yeah,
of course. We're trying, a pet project of mine is to try and develop kind of, a screening process that we can do fully remotely. So if anybody's got some creative suggestions for me, throw them at me, see what sticks. As I mentioned, I feel your pain. I really do. And I feel like, the easier that we can make it on you and the more helpful it is, even if it's not for MD Anderson, I think, we have an obligation to do so. Right. So
yeah.
if we make if we make any advances on that technology, you'll be the first to know it. I definitely will scream it from the top of the mountaintops, but it's something in the process and in the works. We just have to kind of figure out what it's going to look like and how to implement it.
Yeah, and I think there's one more question. So the person asks, obviously trials are impacted by COVID. As you're further along in the pandemic, do you anticipate a greater number of trials moving forward?
This is something that we regularly encourage, our sponsors as well as our investigators to contemplate. We do want to make sure that whenever possible that you can complete whatever pieces of the study remotely. Easy things like questionnaires and surveys were very easily transitioned to something remote or web-based early on in the pandemic. We also provided a lot of our clinical trial drug via like a pickup or mailing. That was one of the things that we did to try and accommodate our patients during the pandemic. Physicians are definitely thinking about this. I don't think that we're quite ready to do everything remotely or kind of outside of the hospital, so to speak. But they are, they're aware of the complications and that there is a need.
Okay. And I think another complaint that I hear about, not just MD Anderson, generally about clinical trials, especially when you have a new wave of, like Omicron or something else coming up, and then everyone's scared to travel, right?
Yes.
So there were many people really wonder if the pre-screening, just where, they can meet a clinician or a clinical trial coordinator and then kind of go through the checklist and kind of see, if right off the bat, they can tell you that, okay, you won't qualify for the current, whatever trials that you have picked. For that, you may not qualify because, of whatever reasons, right? Sure. If that is possible, then they don't have to come over there and then they can avoid a trip, right? Like this is something that I hear, like even if a pre-screening visit can be arranged and then, by telehealth, and then the patient can come over there and then do all the, the physical exam and any kind of blood work or anything.
Yeah.
That would be where you can just, go ahead.
Yeah. Again, that's why I think it's really important to go through the patient registration process, so that we have access to your medical records. Without access to your medical records, we cannot pre-screen you. We cannot do any study related activities until you sign the informed consent document. That's just an ethical violation concern. And that's not unique to MD Anderson. That'll be anywhere that a clinical trial is offered. So the pre-screening processes, as I mentioned, really occur on the back end, where we're sorting and sifting through all of our schedules and all of our patient medical records and actively looking at a high level who has a diagnosis and a stage and certain highlighted, characteristics that would be a good match for these clinical trials. That part we are already doing, like on the back end.
Kristin, this has been great. Somebody's asking, what about cost? But I think that maybe the clinical trials at MD Anderson, that document might go through some of the cost considerations also. Do you think?
Yeah, so part of the enrollment process that all of our clinical study coordinators help to facilitate is a request from our financial clearance center, and they will go through, because each trial's activities are unique and different. Each patient's diagnosis and insurance provider is unique and different. And those combinations can result in, a huge array of possibilities. So we do have a dedicated financial clearance center that will help both during patient registration as well as clinical trial participation to kind of review what the financial responsibilities, if any, would be for you.
Okay. Yeah, so I think with that, thank you so much for your time. And this was very helpful. And like I mentioned, I will download the video, and then hopefully in the next couple of days, it'll be posted in Paltown University. And then I hope that I'll get the links to all the documents that Kristin mentioned, and then it'll also be posted there. So, you know, if you wanted to go back and watch the video again, or, you know, explore some of the links, then you'll be able to do it there. And so thank you all for joining, and thank you, Kristin, for you spending this hour with us.
Of course, anytime.
Okay, thank
Thank
you.
you,
Take
everybody.
care.
Have a great day.
Bye.